Hello and welcome to Heart Matters with Dr. Celeste. We are excited to share with you on this Sunday afternoon. We're going to give it a few minutes to allow people to come on board. We are here today in the clinic here in Birmingham, Alabama, and excited to share with you guys today a few things about heart attacks. So we're going to give it a few minutes here. Good afternoon. Welcome. Good afternoon and welcome. Good afternoon and welcome. Hi, Dr. Jaquel, and welcome. Hi, Dr. Mashika, and welcome. Good afternoon and welcome to Heart Matters with Dr. Celeste. Very excited to share with you guys on a very busy Sunday afternoon here in the clinic a few things about heart attacks. So we're going to give it a few minutes to see if we can allow for some other individuals to jump on board and hear what we have to share today about heart attacks. So welcome. Good afternoon. Good afternoon. And so we'll give it just another couple of minutes here. Again, I'm here in Birmingham, Alabama. Here in the clinic after a very, very busy Sunday morning and Sunday afternoon. We're actually still going here, but excited to share a few things with you guys today about heart attacks. Would like you guys to know the facts about heart attacks. Good afternoon. Okay, so I think we'll go ahead and get started. Again, hi, my name is Dr. Celeste Reese-Willis. I'm a board-certified family medicine physician that specializes in urgent care, and very excited to share with you guys today a few things about matters of the heart. I am board certified in family medicine, as I said earlier. I do specialize in urgent care, and so there are different topics and things that will come up over a period of time. And this month we are focusing on matters of the heart. So I wanted to share with you guys today a few things about heart attacks. I'd like you guys to know the facts. So the first question we have to answer is, what is a heart attack? A heart attack is what occurs when there is blood flow that is compromised to part of your heart muscle. The arteries that supply the blood to the heart, called your coronary arteries, can become narrowed as a result of a substance that is called plaque. Plaque is a combination of buildup of fat. It's a combination of cholesterol and other inflammatory substances, and that slow process by which plaque develops is called atherosclerosis. Ischemia is a side effect of atherosclerosis that can occur over a period of time. Ischemia is simply a decrease in blood flow or a decrease in oxygen, really, to a part of your heart muscle. Whenever you have that decrease of blood flow or decrease of oxygen to that part of the heart muscle, you can have what's called damage to that heart muscle. And then as a result of that, an MI or myocardial infarction or heart attack can occur. So you asked me, so how often do people have heart attacks? 1 in every 7 deaths in the United States has been attributed to heart disease, more specifically to heart attacks. And some astonishing facts are that every 40 seconds, someone has a heart attack in the United States. So we've been speaking here for about 2 minutes or so. So that means that about 3 individuals have had a heart attack in the United States just in the last couple of minutes that we've been speaking. Some more facts that the American Heart Association have researched and discovered is that on average every year about 635,000 Americans have a heart attack every year, and those are new cardiac events. About 300,000 persons have heart attacks that are repeat events. In other words, they're people who have suffered a heart attack previously that end up having a heart attack, and that's within a calendar year. That is a lot of individuals. So that brings me to the point of us being here today. Sometimes people will say to me, why didn't I have a warning? Why didn't I know that I was having a heart attack? Well, atherosclerosis is a process that occurs slow over a period of time, and in actuality, with the way that our bodies are made, whenever you have that decrease in blood flow as a result of that block from that plaque. There are collateral blood vessels that actually help to increase blood flow to that part of the heart muscle that has suffered the damage as a result of that decreased blood flow. So a lot of the times there are not strong warning symptoms that people get prior to having a heart attack. So let's talk about some of the symptoms that people have of a heart attack. The most common symptom that both men and women get when they have a heart attack is chest discomfort. Now, patients will a lot of times describe this chest discomfort in different ways. Some people will say, oh, I'm having a sharp pain in my chest. Some people will describe it as, no, I'm not having chest pain, but I feel like I have a chest pressure. Some people will suggest, oh, I'm having chest tightness. All of these are collectively and individually symptoms of persons that have a heart attack. Now, does that mean that every single person that's having chest pain is having a heart attack? No, that is not true. But patients do have different ways in which they describe the chest discomfort that they are having, which is why it's very important that we pay attention to these signs and symptoms that our body is giving us. In addition to having the chest discomfort, the second most common symptom that people complain of is having some kind of discomfort in their arm or their jaw or their neck. Some people can even complain of having antacid symptoms or discomfort in their stomach. Any or all of these symptoms, especially in combination with the chest pain or chest pressure, are suggestive or worrisome for someone that may be having a heart attack. In addition to having the chest pressure and having the discomfort in the arm or the jaw, some people will complain of having dizziness or lightheadedness or even breaking out in a sweat. Some people will have none of these symptoms. Some people will have all of them. The next symptom that people most often complain of is having shortness of breath. Now, I do want to make this caveat. Just because you're having chest pain doesn't mean that you're having a heart attack, but a lot of times the culmination of these symptoms does draw concern from a physician that you could be having a heart attack. So you have to share with your personal physician and or seek treatment so that we can determine whether or not this is something to be concerned about or not. There are persons that have heart attacks that do not have chest pain at all. As a matter of fact, chest pain is actually the most common symptom with both men and with women, but women are more likely to have other symptoms such as shortness of breath, such as nausea, a feeling of dizziness, or lightheadedness altogether. Women are more likely to have those symptoms. So whenever they're having these symptoms, it causes us to need to pay attention to, is this something that we need to investigate further? And the answer to that question is yes, by all means, investigate this further. So you may say, okay, Dr. Celeste, so you've told me about heart attacks. You've explained that there's plaque that develops in the coronary artery. This is something that develops over time. What are the things that I need to do if I am myself am having these symptoms, or if I am in the presence of someone that is exhibiting these symptoms? The first thing you do is call 911 right away. I can't tell you how important it is if you think that you're having a heart attack to dial 911 right away. So let's talk about that a little bit. Sometimes people will not call 911 right away because they say, oh, well, maybe I'm not having a heart attack. They're in denial and they say, it could be a heart attack, it may not be. I don't want to have a false alarm. Well, it's better to check it out and it be a false alarm than it be something that should have alarmed us that we didn't pay attention to. In addition to that, some people they talk themselves out of it. Oh, I'm not having a heart attack. I may be, just feeling a little tired, just feeling a little restless. Well, that's for a medical professional to determine. And I would encourage you to value yourself and value the individual. And if someone is having symptoms of a heart attack, call 911 right away. The things that make a difference as to what someone's outcome is as a result of having a heart attack, one of the most important indicators is the amount of time that occurs between the time of the injury and the time of treatment. As I said before, the injury that occurs is a decrease of blood flow or oxygen and nutrients to that piece of the heart muscle. So over that time, that heart muscle can can be just damaged or it can be dead altogether. Because the heart is such an intricate and wonderful organ, it will sometimes still function, but it may not function as well as it did previously as a result of the injury. So when you decrease the length of time between the injury and the treatment, you largely decrease the likelihood that you will suffer some of the complications of having a heart attack. So if you think that you or someone else is having a heart attack, do not hesitate. Dial 911 right away. So next thing, Dr. Celeste, what do I do to avoid a heart attack altogether? The most important thing is managing the risk factors for heart attack. So let's go over some of those. The 5 main risk factors for having a heart attack and or having a stroke include having high blood pressure. High blood pressure or hypertension is elevated blood pressure. The most important thing that you can do to help prevent the likelihood of having a heart attack or a stroke is seeking treatment for your high blood pressure. And not just seeking the treatment, but being consistent and persistent in treating it, as well as following up with your primary care doctor to make sure that your blood pressure is controlled. Secondly, having high cholesterol. We talked about the development of plaque. Part of what makes a plaque, a large part of what makes a plaque, is cholesterol. So the way that we decrease the risk of someone having a heart attack is to help control their cholesterol. So that simply is getting a regular visit with your primary care doctor, finding out, number one, do I have high cholesterol? If I have high cholesterol, what do we need to do to treat it? Or what can we do to improve it or make it better? If you know it, you can do something about it. If you don't know it, or you choose to say, well, I'm just not going to go in, I don't want to know. Sometimes people are apprehensive, and some people figure, oh, it's better to not know than to know. It's always better to know, and it's always better to seek after some sort of treatment program with your primary care physician. So, risk factors we've discussed already: high blood pressure, high cholesterol. Next risk factor, large risk factor, and sometimes we call this one a double risk factor, is having diabetes or elevated blood sugar. If you have diabetes, you are at increased risk of having a heart attack. So the things that we can do to help prevent the likelihood of having a heart attack is controlling the blood sugar, seeing your primary care physician regularly, and you taking control of your health and monitoring your blood sugar on a regular basis, following a diet that has been set out by your primary care physician and your other specialists that are treating you for the diabetes. I cannot tell again to you how important this is. Next risk factor is tobacco use or smoking. Smoking largely increases the likelihood of you having a heart attack or having a stroke. So not smoking will largely decrease the likelihood that you'll have a heart attack or stroke. The 5th risk factor, and it's sometimes one of the most important ones for you to pay attention to or have knowledge of, is do you have family history of heart attacks? Ask your parents. Ask your sisters, ask your brothers, ask your aunts, ask your uncles. If you have family history of having a heart attack or stroke, it is imperative that you follow up with your regular physician and have regular visits to determine, do I have high blood pressure? Do I have high cholesterol? Is my blood sugar elevated? That is very important to know. Next thing that we can do to help decrease the likelihood that you'll have a heart attack is exercise. We talked about that last week. Exercise. When you exercise, I promise you, you are loving on yourself and you make everything within your body work a little bit better. You increase your blood, you increase better blood flow, you actually decrease stress levels, and it also largely decreases the risk of having a heart attack or stroke. Again, I caution you, if you are already a heart patient or a kidney patient, make sure that you discuss an exercise regimen with your physician prior to beginning that exercise regimen. So let's kind of recap that. So the things that we can do to avoid having a heart attack are paying attention and monitoring our blood pressure. Do we have high cholesterol? If we have high cholesterol, let's treat it one way or the other. Let's keep it under control. Following a balanced diet that is low in cholesterol and low in salt will decrease your risk of having a heart attack. If you have diabetes, let's keep that blood sugar under control. Have regular visits with your personal physician. Everyone that is diabetic should be having a level that's called a hemoglobin A1C. That is a blood test that tells us what your blood sugars averaged over the last 60 to 90 days. That is very important in helping your physician to determine where your blood sugar is, and if you need a difference in medication, whether you need medication at all. Sometimes people don't need medication for diabetes, but that is for your personal physician to decide. If you do have diabetes, let's keep it under control. Let's regularly monitor it with a hemoglobin A1C by having regular medical checkups with our primary care physician so that we know our numbers. Knowing the facts and taking control of your health is something that you can do to decrease your likelihood of having a heart attack. Not smoking will decrease your likelihood of having a heart attack. And then lastly, knowing your family history. I cannot tell you how important that is. That's played a major factor in some of what helps to motivate me to share with you guys, as well as to share with my patients and share with people that I see even every day on the street, the things that they can do to take control of their health and decrease their likelihood of having a heart attack. So with that, you guys, I want to wish you a happy Sunday afternoon. Thank you so much for taking some time out of your schedule to share here with me, Dr. Celeste, today. I'd like to challenge you guys to go out and have a regular medical checkup if you haven't already with your personal physician. Know your facts, know your numbers, and know your family history. You can follow me on facebook.com/Dr. Celeste MD. That's facebook.com/DoctorCeleste MD. Thanks so much and have a great Sunday afternoon. See you on Saturday.